Welcome, Mr. Secretary. I want to add to the conversation about a public option. Senator Brown and I actually wrote the original public option that we came one vote away from getting into the Affordable Care Act. And we are delighted with Senator Bennett and Senator Kane's activities in this space as well. And my ask would be that when you have your team assembled to deal with the public option and look at the specifics of eligibility and actuarial solvency, that we have a meeting, that you convene a meeting with your operating people and all four of our offices so that we can get to the detailed work of drafting legislation that you and the president could support.
Senator, we'll be available to you whenever you call.
Do you have a team yet assigned to public option?
We have a team that's been working on a number of these different proposals because we want to be ready for whenever you all might launch.
Great. Okay. Well, we'll organize the meeting then, and I appreciate it. You and I have had this conversation before, and you mentioned it just now regarding your dad passing away and how important it was to your family to have him home and to have support from the healthcare system. I had, as you know, the exact same experience, and it was meaningful to me. You also talked about local leadership and models. I just wanted to point out to you that for the better part of a decade now, I've been working on a model for end-of-life care that we have pretty well teed up in Rhode Island. It would be approved through CMMI because we're asking for a number of waivers that while they may be useful, while the underlying rule may be useful in the abstract, when it's applied to an end-of-life population, it becomes ridiculous, like the 3-day, 2-night rule, or the you've got to commit granny to the hospital to get respite care rule. And what we want to do is to get a Rhode Island project up and going that combines all the waivers. And I think as you've talked about local leadership and models, this is a really important thing to me. I know that CMMI and Ms. Fowler report to you through CMS and Ms. Brooks-LaSure, but I wanted to mention here the importance of this to me. I've worked on it for a long time. We are ready to go. The problem has been really turnover at CMMI as administrations change and personnel has changed. So I've been in Groundhog Day with new start after new start after new start. And this is the moment where I'm actually quite determined to finally land this thing after circling and circling and circling. So I urge you to let your team know that this is important to me. And I think it's a good project. And if you'll take a close look at it yourself, I think you'll see that this is the kind of thing that you and Ms. Brooks-LaSure and Ms. Fowler should all give a thumbs up to. So I flag that for your attention, if you don't mind.
Senator, look forward to working with you on that. I flagged it for my staff. We'll follow up.
Great. I've been through enough Groundhog Days on this. I hope you can appreciate that impatience comes at some point.
I hear it in your voice.